Hello, my name is Convince Njira, student at Purdue University Global, and today I'll be doing its 7 journal presentation. So this week at the clinic, we saw a patient with commanding auditory hallucination, telling him to, harm himself, and this has been going on for 2 months now, and it became severe 2 weeks ago. Um, he probably was using substance, and but he denies the same. But the parent says that he has been, probably using marijuana, but the patient refused to do a drug test, which was really hard, to quantify about his auditory hallucinations. There's no family history of psychosis, and so the patient presented with deep cuts on his bilateral arms, but he's been very avoidant to show even the parents or anybody, and he usually puts on a long sleeve shirt, which makes it really hard to to see the cuts. And he confessed that he had the cuts, deep cuts, but even as as when we're doing the assessment, he refused to to show us or expose his his cuts. And the more we tried to intervene, the more he was getting irritable. And when we're doing the assessment, he said actually he was having like active the voices were actively telling him to self-harm, but he didn't even state what he used to self-harm. And which was really hard to like really assess the patient and come out to the correct diagnosis, apart from alter hallucination and self-harm. When we ask him like if he's been having lots of self-harm like previously, he denied the same. And even he denied any self-harm behaviors. He just said that the voices were telling him to cut himself and self-harm. And he was really threatening violence when we continue to assess. And so this was quite unique because I've never experienced like a violent patient before during assessment, and I've never experienced a patient who refused to have assessments done on him, especially patient who are having self harm, because you need to assess and see how the situation was. And we had to call the ambulance because then he was a threat to himself and of course others, because he was threatening violence. So at this point then I realized that I needed to sharpen my assessment skills and be able to like gather all the information, especially on aggressive patient. Sometimes it's really hard to do assessment if patient is not willing. But that was a wake up call for me to to learn more about having a therapeutic relationship with the patient and trying to get us information or even collateral information as much as we could. Um, because this patient came to the clinic and he was an accompanied, so the parents on the phone trying to give us information. So if we knew this, because this was an issue assessment, we could have asked maybe the parents or someone else to accompany the patient, someone whom they trust, and because it would have been easy to get all the information that we needed at that particular time. So in future, I tend to um, learn more and read more about aggressive patient, auditory hallucinations and those presentation, and also where to get help, and the referrals to make, or inter interprofession collaboration, sending them to therapy as well, and how to manage such patient. Thank you very much.